Michele, can I ask what policies or structural change you think the NHS could have to sort of prevent similar outcomes, the role of whistleblowing, how these could protect healthcare staff?
I think you have to have an outside agency who's going to come in and look at these cases. You can't have the organisation investigating the organisation because there's immediately a bias there. There needs to be a completely separate investigatory organisation that comes in and looks at spikes in deaths that can be called, that maybe could have a phone line where parents can phone up if they have concerns. Very often, if you look at the lobbies that have gone on in Shrewsbury, Nottingham, and now Leeds, they have all been driven, and Morecambe Bay, by parents. It's the parents who've got together collectively and started screaming and shouting and saying there's something seriously wrong here. So I think there's lots of things that need to change. I think the National Health Service needs to start valuing its nurses, and the government needs to start valuing them. I don't really want to make a political statement, but nurses are not treated, certainly registered nurses, the way they should be. They're very easy to be got rid of because they're employers in the cost-cutting cases. They're being replaced with unqualified staff.
What's your personal reflection on this case and its broader implications for the healthcare system?
I think you have to look at what is happening within the National Health Service at the moment. We have had the Donna Ockenden reviews into Shrewsbury and Nottingham. There is another inquiry coming into Leeds. Only this week, the coroner has stated about a baby called baby Ida, who tragically died in the Royal Lancaster Hospital. Now, they had an inquiry in 2015, and they were supposed to have made changes. The coroner this week just said that hospital, despite recommendations and everything else, have just ticked a box and the problems are still there. That is the same in Chester. Chester was no different. The only difference was they pointed the finger at an innocent nurse.